So my name is Caitlin. You guys know I'm a nurse practitioner student at Auburn. These are my friends Sam and Scarlett. So I'm just gonna ask you guys a few questions about which kind of gauge what you know about nurse practitioners. But before I do that, what do you guys know right offhand? Anything come to mind?
You may just help, like, before the doctor comes in.
You think so?
That's what I think.
Okay.
No.
What do you think?
They're kind of like their own specialty.
Okay.
They're not like the exact same as doctors, but they're not just nurses either.
Right, okay. So the first question is, what do you think FNP stands for, and what do you think an FNP can do?
Family nurse practitioner.
Yeah?
Well, I guess so. We can give you, like, shots, I guess, and, like, vaccines and something like that.
Okay.
It's like family medicine and primary care.
Okay, so what do you think that includes?
Just really just like going to see your PCP, like
Yeah.
wellness exams, checkups. If you're sick, you can go there.
Yeah, FNPs primarily do primary care, urgent
Yeah.
care, family care, all that kind of fun stuff. So do you think an FNP can diagnose illnesses?
Yes.
Yes.
Yes, they can.
Trick question.
Do you think an FNP can manage chronic and acute illnesses long term?
No, not long
But it
term.
maybe depend on, like, the case, maybe.
Maybe. Is that what you think?
Yeah.
So they actually can.
Really?
Mm-hmm. So primary care, usually if a patient comes in with an issue, either the primary care physician or nurse practitioner will manage that, or they'll refer the patient out. And then once they're referred and they get that care, if they need specialty care, the nurse practitioner will manage that long term in the primary care setting. So if somebody ends up having, we'll say they have a stroke, so they end up going to the hospital, they get put on medications for that. We'll manage them long term with the medications that they're on after that, in addition to their cardiologist. So yeah, they can do a lot. Do you think an FNP has to collaborate with a physician?
No.
No.
You don't? It's actually dependent on the state. In Alabama, they do. In most states, they do. There's a few states that have what's called full practice authority, where they can practice independently, which is what nurse practitioners are moving towards, but we're not quite there yet. So usually you do have to collaborate with a physician, and in Alabama, you do. Do you think a FNP can order diagnostic tests? So like labs, x-rays, stuff like that?
Yes.
Yes.
They can. Because they are part of the full, see the patient, order the test, diagnose, treat. You can do all that. Do you think an FNP can do simple office procedures, such as joint injections, sutures, stuff like that?
Yes.
Yes.
They can.
And Botox.
Mm-hmm. Yes, and then you can do more depending on, you can, thank you, Denver. You can, get extra education. So you can go to seminars, get certifications to do additional things too. Do you think an FNP can write prescriptions?
Yes.
Maybe not for everything.
Like what?
Like, really hard pain pills or, like, painkillers.
So like controlled substances?
Yes.
Yeah. So in Alabama, you have to have an additional license to prescribe controlled substances.
Yeah.
But other than controlled substances, nurse practitioners can prescribe medications. And do you think an FNP can bill for their services?
Yes.
Yes.
Yes. So, what is the difference between an NP and a PA? Do you know?
Like a...
PA's physician assistant,
Mm-hmm.
right?
I have no idea.
Is that all you know?
Hmm?
You just know the difference between the names?
Well, the PA is like an actual assistant,
Uh-huh.
and NP is like their own thing.
Right.
Like they're kind of in charge.
Yeah. So PAs have to practice under a physician.
Yeah.
The schooling that they get is a little bit different. In nurse practitioner school, we go a little bit more by the nursing model, so you look holistically at the patient a little bit more, and PAs kind of focus on the medical model, so how to diagnose, treat, identify, that sort of thing is the main difference. And I guess the last question is, after we had this little discussion, do you think F&Ps should have full practice authority in every state, or do you feel like they should practice under a provider?
I think they should be able to do their own thing.
Why is that?
It seems like they have the training and they know what they're doing.
Okay.
Yeah, like you have the additional schooling that's needed. You don't really need someone looking over your shoulder.
Yeah, that's what we're working towards. Hopefully one day. Well, thank you guys for
You're
answering my
welcome.
questions.